Hey listeners, just jumping in quickly before the podcast to notify you about the BodyTrack Academy educational webinars that we have available via Eventbrite. We cover a variety of topics ranging from oncology, musculoskeletal rehab, neurological rehab, mental health, performance and much more, all of which you can access 24/7. That means you can purchase the webinar and watch it at any time that suits you. You can claim our webinars as PD points via SS self-assessment tool, and as a valued listener of the podcast, you're entitled to $10 off any of our webinars, but do hurry because the code is only available to the first 10 purchases. Just use the code FIRST10. So head on over to Eventbrite and browse our webinars. The link is in the show notes and on the BodyTrack Academy Facebook page. I'd like to begin this podcast by acknowledging the Yagara and the Turrbal people as the traditional custodians of Meanjin, the lands on which our podcast is recorded. We pay our respects to elders past, present, and emerging. Welcome to the BodyTrack Academy podcast created by EPs for EPs. The podcast will take you on an in-depth understanding of everything an EP is faced with on a day-to-day basis, including clinical, personal, and business practices to ensure you become the best practitioner possible. If you enjoy the podcast, make sure you like, share, follow us on whatever streaming service you use to ensure the message spreads and you are notified of any new podcasts or educational resources available to you. Furthermore, if you're not already part of our online academy, head over to Facebook and join the BodyTrack Academy. Happy listening. Thanks for listening in to another episode of the BodyTrack Academy podcast, and our commitment this year is to have a podcast released every fortnight with maybe a little break in between for some planning. But today, without further ado, I'm joined by Campbell. Campbell, how are you?
Good, Dan.
Fantastic. Now, bit of background, Campbell is our clinical team lead in the S&C and the generalist field, which also does sort of include musculoskeletal. So a very good EP to have a chat with today on a specific case study that we're going to go through. Heard feedback from the associates saying that you're really enjoying the case studies, so we thought we'd do another one on a long-term client of yours, Campbell. So without further ado, let's run through from the very start that this lady came through, a bit of demographics, and we'll plan out to where she is now. Take it away, Cam.
Thanks, Dan. So this client, she originally came in 2021, referred by her doctor for osteoporosis, a recent DEXA scan that she had. It kind of took her by surprise a little bit. She enjoyed exercise. She walked every morning, and she was healthy in all other aspects. So she was just a bit blindsided by the diagnosis of osteoporosis, and then she hadn't heard of an exercise physiologist. She came in and we had a really good kind of initial session, education, and then she's been seeing us pretty much since middle of 2021 to
Fantastic.
to 2024.
It is. Wow, how time flies. So let's, before we go and unpack the assessment that you went through and how this client has progressed over that time, let's just start with that situation in particular. Someone who has enjoyed exercise, has been walking mostly, and then presented and not knowing what an exercise is. How many times do you feel you've been faced with that over your career?
A lot. Most doctors' referrals will get that kind of response of like, oh, how can you help me? What is an exercise physiologist? So it's always good to ask if they know, and if their knowledge or their expectations of seeing an exercise physiologist is what we actually can offer, or but yeah. So it was pretty much, she came and had no idea what an exercise physiologist was, of course, and then I just explained what we are, what we do. And then we went through and kind of unpacked her fears around movement and her her thoughts about what was needed for exercise. And I think I clearly remember her beating me to the point of being like, I need to do weight bearing exercises. And it was straight into what her doctor or I think someone she knew had said.
Yeah, okay. And she currently wasn't doing weight bearing? Was it just the walking that she was doing?
Just the walking.
Yeah.
And then I proceeded to ask her, well, what does weight bearing look like for you?
Yeah, okay.
And what does that mean? And she had no idea. She just knew that she had to do some type of weight bearing. And when we talked about it a bit further, she actually assumed that weight bearing was bearing her own weight.
Ah, right.
And not like bearing external weight. So it can get confused a bit of having that, like what weight bearing means. It means something different to everyone.
And I think you just highlighted a very good early take home point. Is never assume. Even though it says on their referral weight bearing exercise, they might not have any idea, and in this situation that seems to be the case. So you've asked a very good open-ended question, get their experience of what it is, because the answer may surprise you or they might nail it on the head, but it's a very good take home is ask that open-ended question and don't assume that they know what their condition is, or in this case what weight bearing exercise is. So let's go into that assessment a bit. Talk about after the educational part, you're onto weight bearing exercise. Where did it kind of go from there, Cam?
Because she hadn't done any weight training before, I did want to just get a general assessment battery. So I did the kind of the classics in terms of sit to stand assessment, grip strength assessment, balance assessment, and just getting an overall baseline of where she was at. Because it was affected, like the osteoporosis was affected in her lower back predominantly. I also did a lumbar extension hold assessment, which is like lying on your stomach and just bringing your chest off and seeing how long you can hold there for. And that's something that is in recommendations for assessments for osteoporosis, but also can be a bit of a daunting one for people. And she just found there was a couple of things that stopped. She did have that more kyphotic posture, which tends to be present in some clients, especially like the older female age group who have osteoporosis. And she found it really difficult to hold her body weight up.
Okay.
It could be from more of her upper back, but she felt it significantly in her lower back because she just couldn't hold herself off the ground.
Right.
But yeah, and then we just pretty much went straight on to recommendations and where she was compared her to normative data, and then we went from there.
Great. Just taking back to that time when she felt her lower back during that assessment piece that you did with the lumbar extension hold, and you were talking before about her fears around movement and fears around potentially weight training. How did you navigate that situation?
Well, I first made sure that she was aware that if she had bone density, like lower bone density scores in a specific area, that we needed to focus on that specific area. And from as soon as she was aware that there needed to be a focus on her lower back, because her lower back was lower in bone density, and her hips were too actually, but she trusted me in terms of like, well, let's assess this, but not to a point of danger or heavy weights or compressive loads or really shear forces or anything like that in the assessment phase. I just wanted to make sure I was like, we're just going to have a lie down. I just want to see if you can hold this position. I didn't necessarily word it in this is to see your lower back strength.
Yeah.
I just wanted us to see if she could tolerate specific movements. And yeah, I think she was pretty happy to just go along with it, knowing that there wasn't any big weights or things that she was a bit worried of.
Great. And I think again, another take home from that point there and how you navigated that situation of someone coming in who might be fearful with some movements is the reassurance that you provided. You are the health professional, you've educated, and I would dare say without that education you provided, that trust in you from the client would not be there, and that test could have gone different for someone else. So associates and those listening, a very good take home there is to build that rapport quickly, but be the professional and be firm in saying this is what we need to do, and this assessment is going to show us where we're at, because without that education and understanding for the client could look very different about that experience for them as well. Post-assessment recommendations that you provided to this client for ongoing sessions, minimal dosage. How did that go down?
I started with going through the evidence-based recommendations before we decided picking what route she was actually going to come see us with. Sure. And pretty much ESSA have a really good resource available to. It's a CPD course as well for bone density and osteoporosis, and they have a full algorithm and recommendations. And there's also really good recommendations from like the Lift More program.
Yep.
It's an overseas and things American program. The Anero Bone Protocol in Australia that is based off that.
Yep.
So I know that there is an Anero clinic in Brisbane that do it, but the recommendations that they have, I kind of explained to the client. I said, look, these are probably the things that we need to aim for. This is and understanding that bone density from the literature shows it takes 9 months to properly see of progressive overload resistance training to see benefits in bone density, and 12 months for it to be actually quite long lasting. So putting those expectations early and saying this is going to be something that we'll need to progress and need to be continuing on. This isn't a quick fix.
Yeah, again, vital. Really, really important that piece of information for clients to continue on and understand the importance of exercise.
Yeah. And she responded really well to that. She was like, okay, well, I didn't know it took that long, but that's good, and it kind of put her in a positive mindset about okay, let's commit for the next 12 months, and this is what this is going to look like. And I went through the specific amounts of impact loading and balance and resistance training that she needed to achieve within a week, and then just talked about how we're going to make that happen. What does the week look like for you to obtain this? And she was very honest about not being the most proactive at home. She loved going for walks, but in terms of strength training, she's never really committed to strength training. I think all her kids did F45 and things, and she just never really understood it. So she was just like, okay, I can see myself committing to this, but I have to be in a clinic. Or I have to have an appointment there. So we just started with that. We said, okay, well, let's make a couple of appointments for you to hit these 2 strength training sessions, and from there we'll just see how we go.
Yep. The thing I really like that you've done is you've included this client in constructing their journey towards better health. You've done it in a way where you've been the professional, you've informed them about this is what it takes, but you've done it in a way where they've got to make their decision as well, and you haven't forced anything upon them, and you've built that constructive exercise week with them rather than kind of not against them, but telling them exactly what to do. So that again, it's the client who's making that journey for themselves, and Cam, you've done a great job in terms of supporting them and being the professional to guide them through that. So pat on the back for that as well, and a good take home for anyone listening. Before we get into what our session looked like, any pharmacological interventions alongside this, and does that have any impact as well to that 9-month or 12-month time taken to see change?
In this case, no. She was very keen to do this conservatively, and her doctor was on board with that as well. In general, with the osteoporotic clients, it can be a thing that we have to factor in terms of if they're on some biphosphonate medication or medications that may have like bone kind of fracture risks or cardiovascular risks. There's a couple that have more of a cardiovascular risk behind them. Then we do need to be more aware of if their calcium levels are adequate, if they've got an okay level of strength to begin with, or we have to manage their heart rate and blood pressure during the sessions. With this specific instance, no. She was more than she really wanted to do this conservatively.
Great.
But yeah, there's great medications out there for it. A lot of them have like gastrointestinal side effects that stop people taking them. It's feedback that we get a lot. But it's for this client, no. No, it was pretty easy.
So I think important thing from that too is asking about medications that may be detrimental to bone health, as well as obviously any specific medications or pharmacological intervention that is going to support bone growth or slowing the decline in bone loss as well. So that's an important thing to always ask and check in routinely, and also checking in with the GP, the referral, or wherever the referrals come from as well. All right, let's get on to what the session started to look like. So first session, client coming in, done up your program. Let's go through that first and unpack what that looks like and give the listeners a bit of an idea about what exercises you did.
Yep. So we started pretty lower on the impact in terms of because she was. It depends on what T-score that the person presents with and like how confident they are, but like because this client was sitting at about -3, we had to start a little bit lighter in terms of impact. So current recommendations for impact are around about the 50 impacts, starting with 4 days a week and building up to 7 if the person's tolerating it well. But we pretty much just started with some like really gentle kind of like skier jumps to the side, and then some heel drops into the ground, and not too forceful. The heel drops are great for lower back osteoporosis. But then building up intensity as we went, so really trying to be hard in the ground as we went through the first month, just to see how she went. The resistance training was really kind of specific to where she had lower bone density.
Sure.
So because she had, a lot of people will, like I think it's 80% of people with osteoporosis, it presents predominantly in their lower back. For some people, it presents in both lower back and hip. It presents other places as well, but that's where they mostly That's where they mostly worry about for fracture risk and frailty risk. Because she had both, we just tried to get her familiar with feeling what areas that we're going to be working with. So we started in like kind of bridging, planking, back extension hold, side leg raise, just exercises that she was surprised with because she assumed that we'd just go straight into resistance training.
And it sounds like her mindset on resistance and what that looks like is heavy load, like targeted, really, lifting a weight as heavy as you can kind of thing.
And that's it. And like we did have a discussion in our initial saying that that's where we want to be. It's we will build up to a point where you're actually lifting more than you thought you could. But just to reassure that that's not where we're starting. We're starting with you understanding what we want to aim for, what we're feeling, what we're trying, the intensity that we want to hit. The recommendations are that, that 85% of your 1RM or 8 out of 10 RPE for your intensity of the exercise, and that doesn't always mean like weights involved, like that. That can mean intensity in, holding a side plank, for example, trying to get your spine and your lateral hip involved. Like you could hold to a point where they're at that 8 out of 10 and then swap over to the other side. So we had to work out what an 8 out of 10 felt like for her. And we just did that in bodyweight exercises, really, to start with. And then we kind of built and started. And before we knew it, we were into some pretty significant weight. And it crept up on her. She didn't expect it, but she was kind of surprised about how well she was going.
And I think the important part there is, it sounds obvious, but you're starting at a baseline that is suitable for the client and progressing over time, because tolerance, demand, load, all of those factors have to be taken into consideration. Just going back to the impact, how do you know what the right intensity is for that client? Is there certain questions you're asking to ensure that the impact's not too much? Like, as you said, you started with heel drops and you built that up. How did you know when to progress that? How did you get information from the client to just safely progress that?
Hey, thanks for taking the time to listen to our podcast, and we hope you're learning a lot in this particular episode. Just a shout out to our sponsor, HGG Performance, which provide very high quality, innovative gym equipment and custom fit outs to enable you to pivot your potential and smash your performance and rehab goals. They are world renowned for their innovative creations in the gym accessory space, including the best-selling ISO Tib LT, Tib Bar, Wrist Axe, and Nordic Bar. And I got to say, we're using some of these equipment in our clinic and finding some great results. Used by professional sports teams, athletes, and coaches worldwide, as well as the military, health practitioners, and apparently even Joe Rogan uses their gear. HGG is a proudly Aussie-owned company that makes all their gym equipment at their Gold Coast HQ. And our partnership with them, we are stoked to offer you 10% discount on any product with the code BODYTRACK10, so you can experience what all the hype is about yourself. So jump over to their website, go to the checkout, punch in the code of BODYTRACK10 to get 10% off on any of their great innovative gym equipment, and start using today. Thanks very much.
I progress all the impact loading every 3 to 4 weeks.
Okay.
That's kind of like my goal is to be able to progress it.
Is there a reason for the 3 to 4 weeks as well?
Just because I want to see consistent overload for 9 months.
Sure.
If you leave it for 6 to 8 weeks, your body's getting used to things probably too much, we're not giving it enough stimulus to have an osteogenic effect. We need to be having some type of impact, some kind of yanking and pulling on those bones. Purely the way that I get my feedback from, without, that they only do DEXA scans every 2 years usually. Right. So there's nothing that we can get consistent objective feedback from. So the subjective feedback is, did that feel easy? Does it hurt? Do you have any pain?
Pretty obvious.
No.
But important to include.
Then let's go up. Yeah. It's just a point of like, and with osteoporosis, you have to be mindful that it's associated with frailty. So people who have this diagnosis and maybe were a bit surprised by it have a mindset of like, am I going to break things? That's like a first go-to.
Yeah.
So making sure that you're not pushing them, even though they can probably tolerate it, making sure that you're not pushing them too early, because the mindset still might be, is this going to cause harm and pain?
And we know the relationship. There's other podcasts we've done this, and there's abundance of literature about the mindset and how the body will react and predispose itself to a movement consideration or fear avoidant movement as well.
Yeah.
The other thing I wanted to go on to as well is, it sounds obvious, start low, small body weight and progress over time, but that looks very different if you weren't using those 85% or 8 out of 10 difficulty, and that conversation, and that's the pure importance of subjective. Because if you went osteoporosis client coming, I'm going to look at literature, okay, I've got to do 50 impacts and I've got to do resistance training at 85%, I'm going to do that straight away. You could take that and go apply that straight away to a person who doesn't have a lot of history or has minimal history of resistance training. The outcome looks very different. This client might then be presenting going, I am getting painful in this. Is that muscle pain or is that a fracture risk? And there comes in the mindset as well. So again, it sounds simple, but great to include is that subjective analysis is so important when you're taking a client through resistance training and impact training for osteoporosis management.
Yeah, and understanding that 85% or 8 out of 10 doesn't mean, like, if you see that written on paper, you look at that being like, I'm going to have to absolutely flog myself in this session to get through it. And that's not what it means.
Exactly. Yeah.
85% means something different to every single person. It's just, we need to get to an intensity where they are really feeling the exercise.
Yeah.
It doesn't matter what exercise you do with that. It's just working with the client to make sure they understand that, instead of just saying, you need to hit 85%, because that's daunting for someone who's never strength trained. And a lot of the time, clients who are osteoporotic, they haven't strength trained.
That's right. Yeah. And that you cover very nicely in the osteoporosis educational webinar that we do have available for our associates to learn from as well and access 24/7. Can you take us through that one as well, really in depth of how you bring clinical research to practice? And that's what we're really essentially talking about here. You know, on paper, 85%, 8 out of 10. Like I was saying before, you could take that to the cows come home and go, this is what I have to do. I have to follow protocol, but you're not thinking about the person in front of you. The practical application is what we're talking about and what the educational webinar goes through really well. Let's jump to where this client is now. So about 3 years with us.
Yep.
How has this client progressed? What have you noticed? And also, what challenges have you faced?
So the biggest challenge that I faced in pretty much her whole treatment with us is she has frozen shoulder. And a lot of the exercises that are recommended, like if we look for the Lift More program, if anyone listening doesn't know what the Lift More program or the Narrow Bone program is, it's pretty much 3 exercises. It's a deadlift, squat, and a shoulder press, all with a barbell. And you just work about 5 reps into a really good intensity with some loading, jumping, and stuff as well. And it's just progressively overloads over 12 months and further if the person sticks with it. So 2 of those exercises she was unable to do. She can't get into a back squat position. Her shoulder didn't even nearly let her. Their shoulder press was extremely painful. And deadlift was also not the most comfortable thing for her as well, because just holding that bar. It has got so much better now. Now she's got full range shoulder press. We're getting her now doing back squats, and that's been a long journey to be able to get her shoulder back to that position. But she's now getting into back squats. But it's all about like how creative can you be with this specific program, because if we were to go, okay, I need to do like a bone specific program, she wouldn't be able to do half the exercises.
Exactly.
So I've had to keep her at the intensity that we want to keep her at, while still being able to get her through a session without just having that like shoulder pain and shoulder soreness and stuff like that. So it's always been a challenge for her, because she has a very different right to left leg. You know, right leg's really weak, and has a lot tends to show a lot different movement characteristics in her left. doesn't mean I change any of the exercises, but it does mean that we have to keep that in mind. She has had a right knee injury from years and years ago, but again, that's doing a lot better now. She has now progressed into hiking, and she travels all around Australia to hike now.
Fantastic.
She's just, every weekend she's doing some other competition and stuff like that. So she's really liked the transition into the hiking. From just the walking every morning. She still does that, but now she's in a hiking group. So she does the Mount Cootha on one week, and then on the weekend she's always signed up for something and going away for weeks on end hiking. So I think it's just got her more confident in her body.
That was going to be my question. Do you think she would have done that before doing resistance training?
I don't know. I don't think so. I think that it's what she mentions is how she always gets comments from people because she powers past them on the and younger people, and she's 70 now.
Fantastic.
So
she's part of the young whippersnappers on Mount Cootha.
And she's in the group and she's like, hey, dude. And it's more so just that, like, she feels that obviously gives her a bit of motivation.
Of course.
But it's just more so she felt strong enough to do it, and she used to always complain of her balance being really bad balance, but the stronger she's got, that's kind of like it is helping. And she's not having any of those like really unsteady periods. Hiking is unsteady in a lot of ways, but she's confident to do it. So I don't know if she would have done it without the strength training side of things, but I think it's helped her to just gain confidence in her body.
Fantastic. Well, we might wrap it up there and just main takeaways from today's chat, Cam. If someone is about to approach a client who has osteopenia or osteoporosis, what's your one takeaway or main takeaway that you would have for this population?
My main takeaway for any practitioner is have the recommendations there with you. Have them there so you can show the client. Like, that's enough buy-in. Just having the current recommendations for bone density improvements there. If you can have that and you can reference that with them and work out how that works within their life, you're already a step above. You know, if you're going in there being like, strength training's good, but there's no really clear direction.
Nothing tangible.
Nothing tangible. I think that's changed it all for me. Like the more research that has come out of it, because it's only recent that osteoporosis, specific osteoporosis recommendations have really been. There've been some for a while, a lot of pharmaceutical ones, but it's only very recent that we've had really clear guidelines. And if I was a practitioner, I would get those guidelines. I would research the Lift More program. I'd go onto ESSA and get the ESSA recommendations for osteoporosis, and I'd work out what that looks like in your clinic and for you. And then I would just have them there. So if you know that person's coming with osteoporosis, you're prepared. You've got it there, and you're already that's onboarding.
Great,
just there.
Cam, it's been a pleasure. Very insightful. Definitely things I can take away and apply already for my own clients, and I hope all the listeners can as well. Thank you very much for joining us on the Body Track Academy podcast, Cam.
Thank you.
Thanks for listening. We hope you enjoyed this podcast, so remember to share, like, or follow to keep updated with all our podcasts and educational resources.